Have you ever wondered why your teen looks anxious? Maybe they're shaking, zoning out, restlessness, or even irritable, but they are just insisting, well, I'm not anxious. To your eyes, it looks just like anxiety, but it might actually be something else happening in the brain. Because here's the truth, not everything that looks emotionally actually starts there. So in today's video, we're going to cover these 5 things. 1, what anxiety usually looks like. Number 2, how some symptoms don't quite fit the picture of anxiety. Number 3, what might be really going on underneath if it's not anxiety. Number 4, why families and even doctors often miss this thing as anxiety. And finally, what you can do next if this sounds familiar. So let's dive in. Hi, my name is Dr. Lee. I'm a pediatric health psychologist and the founder of Teen FND Academy, an online coaching program that helps teens with FND and their parents get their lives back. So let's talk about anxiety. Anxiety is our body's alarm system going off when the brain senses danger. So we all have this sense and we all have this bell of anxiety. And typical signs of anxiety look and feel like racing heart, feeling restless, difficulty breathing, sweaty palms, cold hands and feet, feeling dizzy, tight muscle, worrying thoughts. And these are just examples. But here is what most families miss. Sometimes a teen can have these exact same physical reactions and symptoms without feeling anxious inside. And that is a signal something deeper might be going on. So what happens when anxiety does not look like anxiety? And here is what gets kind of confusing, because sometimes symptoms look bizarre or don't quite line up with these classic anxiety symptoms, like a teen who is suddenly cannot walk or loses balance, but feel calm and chill when that happens, or right before it happens. A teen who zones out mid-conversations and later remembers nothing about the conversation, or a teen who is experiencing jerky or tremor-like movements that come and go and that's very inconsistent, or a teen who is losing speech, like stuttering, whispering, or even losing their voice that come and go, which kind of sounds bizarre, right? And these are real physical symptoms, and we know they're not panic attacks. They're not doing this for attention. And here is the key. They often don't respond to anxiety treatments like therapy or medication for those kind of bizarre that don't quite line up as an anxiety. So if it's not anxiety, then what is it? Well, this is where FND comes in, or functional neurological disorder. Think of it this way. The hardware of the brain and the body are just fine. However, the software, this messaging communication system between the brain and the body, are glitching. So they're not quite working right. And that glitch can create anxiety-like symptoms even when there is no fear or worry present at the core baseline or leading up to these episodes. So the real question is not about, is my teen anxious? It is actually about, why is their brain sending alarm signals when there is no danger? And here is where I want to share a story. I work with this family whose teen has been told again and again and again, like 1,000 times, it's just anxiety. And they tried therapy, breathing exercises, a bunch of meditation apps that are out there on the planet, and even anti-anxiety medication for these quote unquote anxiety symptoms that kind of looked bizarre. But obviously nothing worked. And what finally clicked for this family was realizing these symptoms actually did not look like anxiety, because they fluctuated, sometimes disappearing when a teen's attention shifted to somewhere else or something else. But once this family understood it was actually FND, not anxiety, then everything about their recovery changed in a good way. So this kind of inconsistency is kind of confusing, right? Even to professionals, I admit. But ironically, it is one of the strongest clues towards diagnosing FND, or functional neurological disorder. So let me ask you, have you ever been told that your teen's symptoms are just anxiety over and over again, but deep down you kind of knew something didn't add up? Share in the comments if that's the case, because I really want you to know you're not alone. And here's the deal. The sad news is families often spend months, maybe you, sometimes years trying to fix this anxiety that isn't really anxiety to begin with. The reality of the worst case scenario is that these teens eventually start feeling anxious. So the solution is not just about calming their mind, it is actually retraining the brain and body connection when it comes to FND. So that shift from managing stress to the retraining the signals between the brain and body is the first step toward getting the right kind of help. If this sounds familiar, please know that it does not mean you have done anything wrong. It just means that there is likely more going on than meets the eye. So I will keep saying this again and again and again. FND is real and the recovery becomes possible once it is recognized by you, your teen, and the doctors. Awareness is where it all begins because once you understand what's happening, the next step becomes clear because now you know what you're dealing with. So here's the thing. You might be now asking, well, okay, if it's not just anxiety, then how do stress and anxiety actually fit into all of these things? Well, if that's what you're wondering, because many families are still noticing symptoms of FND flare up under stress, and it can feel really confusing. And that's exactly what I cover in my next video over here, where I break down the relationship, what is quite surprising, between stress, anxiety, and FND, and why managing stress alone is actually not enough to break the cycle. And remember, if your gut says it's more than anxiety, then I would say trust that instinct, because when you understand what's really happening in your teen's brain and body, that's where the recovery really starts to make sense. Well, thank you so much for watching this video, and I will see you in the next video.